This video is for those who are already doing the sterile processing course, wondering why you're doing medical terminology, or why you're taking the course on microbiology or anatomy. First, medical terminology enables us to communicate very well with the operating room. It's the language that we speak back and forth from the operating room in order to provide services. You remember that our department is a customer service-based department where we supply user department with finished products such as surgical supplies or sterile instruments. And in order to do that, we need to understand a vast amount of medical terms in order to supply these services or devices to the department. We have to understand medical terms. Why do we need to learn microbiology? In the world of sterile processing, we are dealing with microbes from all walks of life. You have to understand that everything that comes into sterile processing is contaminated from a vast amount of patients out there. And all we have to do is have standard precautions. Understanding microbiology and the viruses and the microbes that you're dealing with will help you deal with them. And I'm sure a lot of you know that not all microorganisms get treated the same. Some live longer on medical devices or any organic material longer than others. For example, tuberculosis will go longer in a dry state until it's reactivated in a moist environment, whereas HIV wouldn't last too long on any medical device over an hour long outside of the body. So I'm not saying take it lightly with HIV and take tuberculosis more serious, but you have to understand the life cycle of these organisms so you know how to treat them and protect yourself and the patient from these devices. And that's our job as sterile processing technicians. And now when it comes to the anatomy of the body, we need to understand which part of the body instruments are used on. And based on the part of the body that the instruments are named after, we know where to pick them from or which instrument to send to the operating room when requested. We also supply labor and delivery, the emergency department, the cath lab, and x-ray departments, or any other department within the hospital that performs any minor or major surgical procedure. So this is for techs who are wondering why you need to understand microbiology, medical terminology, and anatomy as it relates to sterile processing. Have a wonderful day. Check my YouTube channel for more information. I'll see you guys in September for our September sterile processing class. Have a good day. Bye-bye.